Hello, hello. Hi, everybody out there. This is Dr. Janine coming to you today for Thursday tips. All right. I'm just going to wait a little bit here to see if anyone's joining today, and I'll get started with my topic. All right. So, how was everybody's Labor Day? Over the Labor Day. Hi, Lance. How are you? Thanks for joining. I'm just going to wait a little bit here for others to join. Over Labor Day, I had a busy weekend. I flew to Atlanta for a business working event, which was amazing. I'll tell y'all a little bit more about what I was doing in a few months. So I'm going to keep it a secret right now. So some of you may already know what I was doing, but right now for everybody, I'm going to keep it a secret. And then had the pleasure of celebrating my father's 70th birthday, which was awesome. We had a wonderful time. We partied. We just had a great time celebrating him. So that was good to be with family and enjoy celebrating life. Hi, Shad. Thanks for joining. I'm just waiting for others to join, and then I'll get started. So that was my weekend. And then also my daughter was home, so that was even better. That made my weekend even better. And she left on Monday. So she came down for the party, for her grandfather's party, and had a great time as well. It was good to see her. And also for y'all in the track of Hurricane Dorian, be safe out there, and still praying for those in the Bahamas. I know they've been hit terribly. So wishing them, just a lot of prayers, and hopefully we can help in some way. All right, still waiting for a few. Thank y'all for holding on and watching right now. I'll give another minute, and then we'll dive into today's topic. All right. Okay. And today it's a little cloudy here in Pennsylvania, but it's warm, which is good. We haven't started dropping temperatures yet, so that's great. Yeah. So, okay. So let's get started. So today, thank you for joining Thursday Tips with Dr. Janine. I'm Dr. Janine Darby. I'm double board certified in family medicine and obesity medicine. I'm also the owner of Lifestyle Changes, LLC here in Pennsylvania, where I help individuals, especially women, with a comprehensive weight loss program, which helps them better their health, become energized, and also get their sexy back. So if you have any questions about what I do or want to enlist my services, you can follow me on this website, on Facebook at Dr. Janine Darby, or on my website, www.lifestylechangesllc.com. Okay, so today we're going to talk about fall allergies, how to survive this fall allergy season, which starts in mid-August and may run till October, November in certain areas of the U.S. So who's experiencing symptoms currently, like watery eyes, runny nose, stuffy nose, itchy throats, itchy eyes, itchy nose, sneezing, postnasal drip, or you hearing some popping or clicking in your ears? Anyone experiencing any of those symptoms? Okay, so I normally don't have seasonal allergies, so I'm not experiencing any of these things. However, I have family members that do. So we're gonna, okay, All right, Shad. Okay, great. Only in the spring, yes. So there's different allergens in the spring, and there's different allergens in the fall. So the most common allergen in the fall is ragweed. So it's a little grass. I was trying to look outside to see if we had any developing just yet, but couldn't find any just yet. So maybe we have a few more weeks before we get ragweed here. So ragweed looks like a little grass, and so that with the air and wind, the pollen from that spreads throughout, and that causes some of these symptoms that I mentioned. So ragweed is the number 1 allergen in the fall season. All right. And so that starts developing around mid-August, in some areas of the U.S. So right now in Pennsylvania, I'm not seeing any in my grass, but maybe someone else's yard has it, So the other allergens that we see more in the fall are mold, dust mites, and pet dander if you have animals. All right, so mold thrives around like little moist areas in your home. So certain places like kitchen, damp basements, or in your bathroom. So make sure like the temperature is lower so you don't develop mold, or make sure you apply like certain products like vinegar or another chemical that decreases the mold buildup or mildew. Okay. Also dust mites. These mites you can't really see with the naked eye. Hi, Miss Carolyn. Thank you for joining. We're talking about fall allergies today. So I'm talking about the common allergens in the fall. So the next one was dust mites. Dust mites love the bedroom. So I'll talk about little tips about how to prevent the dust mites and how to decrease the allergen and your allergic reaction. All right. Thanks. Thanks for joining, Miss Carolyn. The other most common allergens, if you have pets in the house, so pet dander can cause some allergic reactions. So pet dander comes from dead skin shed by animals. All right. So 40% of people with seasonal allergies, whether it's spring or fall, are allergic to pet dander. All right. So definitely if you have animals, be aware of that. And I'll go through some tips of how to help prevent those allergic reactions. All right. So I'm just going to delve into my tips of how to survive the fall season and the fall allergy season. Okay. So the first thing is, we talked about the most common allergen being ragweed, is keep your home and car windows closed. That will help prevent the exposure to the ragweed. All right. The other thing is when you come into your home, before you even get into your home, keep all the allergens outside. Take off your jacket. Take off your shoes. Do that outside. Or if you have a mud room in your house, do it in the mud room before coming into the main area. Hi, Dr. Monica. Thank you for joining. We're talking about fall allergies and how to survive the fall allergy season. So that's number 2. Keep all the allergens outside. Take off your jacket, take off your clothing, shoes before entering your home. Number 4, make sure you wash your clothes, linens regularly in hot water, to remove all allergens off of those things. The other thing is use a dehumidifier in your home, especially in the basement. You want to keep the air humidity below 50%. So that may be something you want to invest in if you have a household that have allergies. Okay, so a dehumidifier is helpful. The other thing is before the cold comes, you want to clean your air vents in your home before turning on your heat. So that will be helpful as well. The other thing to help with dust mites is cover your mattress, cover your pillows with dustproof covers. So that should help as well, decreasing the allergen of specifically dust mites. The another tip is avoid contact with furry pets. All right, so I know some people love their pets, which is fine. Not hating. I don't have any pets in my home, but if you love pets, make sure you find the breeds that are hypoallergenic. So there are certain dogs that won't shed as much, and you can buy those type. The other thing is, if you have pets and it is a high pollen day, or make sure you wash them more frequently, and then if they're in the house more, keep them off the furniture, keep them off your bed. All right. And the last tip is if you're having problems with your allergies, and some of these tips have not worked, contact your doctor for recommendations. But today I'm going to just give you a few of my suggestions in regards to treatment to your allergies. But definitely discuss with your doctor what certain things that may work for you. Okay. Hi Donna, thank you for joining in. We're talking about how to survive the fall allergy season. All right. So we talked about the symptoms of the allergies allergies. So watery eyes, runny nose, stuffy nose, itchy throat, eyes, nose, sneezing, postnasal drip, popping, clicking in the ears. Any of you have these symptoms currently? Okay. All right. So some treatments that you can do. I'm just going to discuss just a few, but like I said before, contact your doctor before starting on any of these. Okay, you're coughing. Okay, so that could be due to some postnasal drip from the nose. So let's see if any of these treatments can help you. So the first thing, of course, which is the most obvious treatment, is to avoid the allergen. So I went over a few tips of how to help you avoid those allergens. But if you're unable to, let's talk about a little bit more, like certain medications. So there's certain medications that are over the counter and are prescribed that can help you with your allergies. So for one, decongestants. Antihistamine is another one. Oh, sorry, Dr. Monica. Yeah, the allergy symptoms. Hopefully you started taking something, or I don't know if you do allergy shots, but I'm going to get to that as well. Okay. So decongestion, antihistamine, steroid nasal spray, and eye drops are some medications that you can use. So like I said, some of these medications are over the counter and some are prescribed. Hi, Dr. Lisa. Thank you for watching. Thank you for joining in. We're talking about how to survive the fall allergy season. So I'm going over treatments currently. So decongestants, for example, is Sudafed. So talk to your doctor before taking this medication, because certain people that are on high blood pressure medication should not take Sudafed. So the other option is Sudafed PE. So that's an example. Antihistamine, because with allergies, basically what you're doing is releasing histamines that are causing all these symptoms. And so the antihistamine decreases that allergic reaction, and so you feel better. So the antihistamines are, for instance, Claritin, Zyrtec. Hi, Dr. Mashika. Thank you for joining. We're talking about how to survive the fall allergy season. So antihistamines we're talking about treatments now, Dr. Mashika. So antihistamines are Claritin, Zyrtec, Allegra, Xyzal. Those are over the counter. And some of these can also be prescribed as well. such as Claritin, which the generic name is loratadine. So those are some examples. The other thing that can help with like stuffy nose, runny nose, decreasing that postnasal drip is a steroid nasal spray. So those are, some of them are over the counter and some of them are prescribed again. So the over the counter ones are like Flonase, Nasacort, Nasonex is over the counter, and you can use that to help decrease those symptoms as well. Also, eye drops for those itchy eyes. You can use over the counter. There's Visine A, there's Zatador, and there's also prescribed eye drops such as Pataday for one. All right. Any questions so far about any of these treatments? All right. Okay. Thank you all for tuning in today. I really appreciate you. All right. So if all these medications have not worked and you're still suffering, thank you for joining, Donna. Take care. So if all these treatments have not worked, you've avoided the allergen, you've tried some over-the-counter medications, some prescribed medications, and your symptoms are still severe, the other option is seeking out an allergist. Allergist for testing, and also, depending on what has been found with the testing, they may prescribe or may suggest allergy shots, or maybe a sublingual tablet for immunotherapy, which helps in desensitizing the allergen, okay, and hopefully helping your symptoms as well. Okay, Miss Carolyn, you have a question about fluticasone or Flonase. Flonase is the brand name, fluticasone is the generic name. Go ahead and ask me your question. I'll keep going. All right. Alrighty. So those are some of the treatments. All right. So hopefully this has helped. And hopefully, okay, methylprednisolone. So prednisolone. Okay, so that's a steroid. Okay. Hi, Dr. Celeste. Thank you for joining. We're just talking about how to survive the fall allergy season, and we were just going over some treatments just now. So treatments, we were talking about first thing, avoid allergens, medication, and then the third thing is seeking out help from an allergist for possible immunotherapy. Okay, all right. Okay, great. So these are some of my tips on how to survive, and hopefully this has been helpful. The other thing to mention with the medications is you don't want to wait till your symptoms are so severe and you can't get and you can't get it under control. So you want to start taking these medications optimally a few months ahead of fall allergy season, but if not, definitely 2 weeks prior you want to start. Okay. Flonase is good. It's a good start for a nasal spray. Yes, Miss Carolyn. That's a steroid nasal spray. It helps in decreasing the postnasal drip and also decrease any type of inflammation that you're having in the nares, and also the eustachian tube. So that will help if you have any clicking or popping in the ears or pressure as well. Okay. Hopefully that's helpful. All right. So start your treatment before the season happens. Which will be helpful, and you will survive and not be miserable during this time. But in the winter months is a good time because most of these allergens have gone away, and you can live life. All right. So thank you all for joining. If you don't have any further questions, if you have any family and friends that need to hear this message, please share, and tell them to follow my page. You can follow me at www.facebook.com, Dr. Janine Darby. And then also if you want to make an appointment with me. If you live in the Pennsylvania area, you can now book an appointment on my website, which is at www.lifestylechangesllc.com. All right. Okay. Dr. Mashika said something here. Should I take meds daily, even if I feel okay one day? Yes, you should. So if you know that you have allergies throughout this time, you shouldn't take it just one day. You should take it on a daily basis to ramp the medication in your system, and also it helps you feel better from day to day as opposed to just one day. All right. So usually the allergy season ends around like October, November. So I would just take it through that time and then give yourself a break after that. Okay. Thank you, Amina, for joining. We're just wrapping up here. So like I said, I'm Dr. Janine Darby, double board certified in family medicine and obesity medicine. Also help women through my, you're welcome, Dr. Mashika. I also help women through my comprehensive medical weight loss program. I help them become energized, become more healthy, and get their sexy back. So thank you all again for joining today. Hopefully this message has been helpful for you. Like I said, follow me, like and share on all social media platforms, Dr. Janine Darby. Thank you again, and I will see y'all next week. Thank you. Bye-bye.